This is the business of healthcare, and I am your host this afternoon, Habanero, and I'm here every other Friday from 1 to 3 p.m., alternating with Chris Sirochin, and his program is If This Be Treason. My guest today is Ken Sternfeld, and Ken is a registered pharmacist. He works at CVS, and he is the founder of RXVIP Concierge, which is a new way that pharmacists can practice right in physicians' offices. Ken also has developed a career development program called RXVIP Cares, where he teaches pharma interns how to become providers. And we've actually got a couple of them with us here in the studio. So, Ken, welcome to the business of healthcare.
Thank you. I appreciate it. And thank you for having me join you and the opportunity to speak with your listeners today.
You know, Ken and I met at a networking group. There's a group that we both belong to. It's called Healthcare Introductions, and it's a bunch of people who work primarily with medical providers, and that's how we met.
Yes, it was nice to meet that way because the healthcare business is really collaboration and networking, and the venue that we met in was really a wonderful opportunity for me to meet you and others who have like-minded vision of improving the business of healthcare and improving patient care. So it was a great opportunity, and I enjoyed everyone there and certainly meeting you that day.
And I would just like to give a little shout out. If anyone is interested in learning about that group, send me an email at habanero@wusb.fm, and I can get you information on that group. It's definitely a low-impact, low-maintenance group. So tell us a little bit about yourself, Ken.
Well, as I mentioned, I'm a registered pharmacist. That's a little bit different than today's pharmacist because you mentioned the change. Today, a pharmacist needs to go through a longer educational pathway and become a doctor of pharmacy, which is a PharmD. It's a 6-year course where I went for 5 years. But that was a long time ago. I graduated in 1979 from St. John's University and went to work shortly thereafter in a retail pharmacy, community pharmacy, because my dad was a pharmacist.
So my little introduction about the guy in the white coat that knew everyone in the neighborhood and answered all your questions, you know that firsthand.
My dad was Doc. Doc was the person who the community came to when there was a problem and someone got hurt or they had a question about their medication, or even if they had to bump their head and they were bleeding. Believe it or not, before urgent care and before a physician, they went to see the pharmacist in the community setting because he was the healthcare provider. He was the person to talk to, the person who had that knowledge and would really guide you because he cared about you, because if you didn't show up, he didn't really have a business. And that was my dad, and he was Doc, and I do everything I do in his memory.
So that's something that I talk to people about often. Right now, people go to the doctor very regularly. Everyone in the family goes for just about every little thing. And I remember when I was growing up, and you and I aren't that far off in age. No. You went to the doctor if there was blood or obvious broken bones, and not just blood, like uncontrollably gushing blood. You just didn't go to the doctor.
Well, that's also like being a parent. When you have your first child, if they are squeamish, you run. But the second one, if they bounce off the wall and if nothing's broken or they're not bleeding, you don't do it. But you're right. In the days of old, you didn't go just for checkups or wellness. You went because you really needed care.
Right. So the first stop was that pharmacist. So tell us a little bit more about where you are today.
Well, today I'm at the tail end of my career as a retail pharmacist. And knowing that I loved retail, initially, that's really where I could be the most contact with the patient. But unfortunately, the ability to stay in touch with that patient in a retail environment is challenging. It's challenging because of the need to dispense the prescription so quickly, so accurately, and to do all the workflow that the business of pharmacy dictates that we do. But for me, I really wanted to continue to focus on being a pharmacist and connecting with the patient. So that's why I developed RXVIP Concierge at the tail end of my career so I could continue my career.
And, I think it's probably even more pertinent today because years ago, you might take a medication. For example, if you had an infection, you might take an antibiotic, but you didn't have people on medication every single day for their life or multiple medications. So I think a pharmacist is probably really important today because who helps manage that balance and those potential interactions? And so tell us how you are working on incorporating that.
Well, the fact that I guess last year were about 4 billion prescriptions filled, it's very difficult in the retail environment where all we're doing is moving and counting the pills from the shelf to the vial to the patient and giving it to them, to do the kind of consultation, to do the kind of being aware of adverse drug reactions. There was a study in Chicago just a few months ago where they indicated that in all of the pharmacies, and we're not singling anybody out, but major retailers, independents, who were given prescriptions that had obvious drug interactions that should never be taken together, 63% of them from the largest chains in the company, those prescriptions just went into the hands of the patient. So for me, not the numbers, how many patients can we help? And you really have to deal with a patient on a one-on-one basis, and that can't be done in what I call fast food pharmacy.
Right. So what's your solution?
Well, our solution was to collaborate where the patient is most comfortable, to go to the point of care. If we collaborate with a physician and become an extension, a valued partner to their care team, there's no reason why a physician would not embrace having a well-trained, well-versed pharmacist or PharmD candidate who's studying all of the necessary things to be a good care provider with their practice. And what we've done is developed a financial model where we can offer that with no out-of-pocket expense to the physician, which is really a game changer.
So what's an example of how do you work with a patient? What might a patient who is coming in to see their physician, how do they wind up with you, and what might some of that conversation look like?
Well, imagine we're a referral, just like if you went to the doctor and had a kidney stone, they'd refer you to a urologist. Or if you had inconsistencies in your EKG, they'd refer you to a cardiologist or other specialists. We're a medication specialist. So within the physician's practice, we are referred patients who the physician feels we can help them by helping them manage their medication. And your point about people taking multiple medications is so accurate. Whereas years ago, if you took vitamin C and a baby aspirin, that was a lot. Now people are taking 8, 10, 12, 15, 20 medications. How can they not need help of someone who is looking at those adverse drug reactions, which kill people?
So you take the time to meet with the patient and go through the whole picture.
Correct. We call it a comprehensive medication review. Kind of like in the old days, something called a brown bag event, where a patient sits with you and goes over the medication, and you look and you listen. That's the most important part of consultation. Is that patient adhering correctly? Is they taking the drugs at the right time? Do they have 2 drugs that are a different color that they think are different when in fact they're the same? Are they taking too much? Are they taking too little at the right time of the day? We call this a wellness prescription checkup. Who wouldn't want to sit down with someone to look at all of the drugs that they take and have someone kind of look under the hood and say, what's going on here with you as a patient? You go once a year to see the doctor for an annual checkup. We feel they should see a pharmacist too, but it cannot be done in a retail drive-through window or at a consultation area where you're filling 500 prescriptions a day. So
what kinds of things do you come across that maybe people in the listening audience might perk them up to say, maybe next time I go see my doctor, or maybe next time I take my father to the doctor, I should find out about this and have this done?
Well, I think the thing everyone is impacted by is the cost of prescription medications. There was an article just this week that said 28 million Americans cannot, in a survey, said they cannot afford their medications. 4 million of them said we didn't pick it up, we don't use it because we can't afford it. So the chronic disease state in America is the cost of healthcare in general, but specifically as a pharmacist, the cost of prescription medications. So when we sit with a patient, we address that. We do a cost analysis. We look at their insurance company to do a formulary check. We look for savings patient assistance programs, not just a coupon that you can go online that doesn't work. We look deep to find a way to help the patient. And that takes time. And it takes compassion, care, and empathy. And you can't do that when you, again, are only focusing on dispensing. We do not dispense any prescriptions in the RXVIP Concierge model. We do not align. We don't care where they buy it. All we want to do is help them on their path to staying healthy.
So you might actually wind up making a recommendation or even talking to the provider about an alternative or a generic or something like that.
Yes, in concept, everyone thinks that could be done by a pharmacist who's filling the prescription. They call the doctor, they say, oh, this isn't covered, it's not covered, prescribe something else. And the doctor may say flippantly, oh, just give him something that's covered. Well, that's not good health care. So because we're in the physician's office and a trusted extension of his care team, we connect with the physician. We collaborate with the physician. And in healthcare, for better patient outcomes, there needs to be collaboration. And we need to partner with the physician and be a part of the care team and be recognized as a provider. In New York State and across the country, with the exception of a few states, pharmacists are not recognized as providers, which means we cannot bill Medicare, Medicaid, and insurance companies. Well, that needs to change. But until it changes, we've already changed it. By collaborating with physicians, with appropriate business agreements, we are paid as providers, and that's also a paradigm shift in the RXVIP concierge model.
So if people are interested in finding out more about this and they want to get in touch with you, what's the best way?
Well, RXVIPconcierge.com. RXVIPconcierge.com is our website, and it gives a very, very top-level overview of what we do and how we do it. But really, the personalized medicine and pharmacy services that we deliver, contact us and we'll talk to you. We'll meet with you. We'll show you what we're doing in practices that we've already established these relationships. This is something that's very exciting for any pharmacist, any pharmacy student, anyone at any stage of their career to learn how to be a patient advocate as part of this RXVIP concierge business model.
All right, so while you were talking, I got that up on my playlist, the website, and hopefully you can take a quick look at it and make sure that I spelled it right before I push the push-up button. But if anyone wants to find out more, that's one additional way to get the information. So how many times do you come? I'm just interested in this because for me personally, I maybe took some things I probably shouldn't have taken when I was younger. And I really now, as an adult, I don't want to take anything unless it's absolutely necessary. And I know everybody isn't like that. In fact, I've spoken to providers who they say they have patients that feel like if they don't leave with something that they haven't gotten their proper dose of health care. So it's always fascinating to me to listen to some of this this type of discussion. I know a lot of people who have the basket full of multiple things that they take every single day. And it's one of the things that's amazing to me is people who will tell me that they're taking drug C to counteract an impact of drug A. And I have to believe that could be precisely the kind of thing that a review with somebody like you could help track down and maybe try some alternatives.
Well, that point of intervention is a life-saving time that a pharmacist needs to intervene. And we have embraced pharmacogenetic testing, which is a customized, personalized review of what medications work for you. And you're right. You don't need to take medication just for taking medication, but wouldn't you like your prescriber to know, based on your genotype, which is really combining medicine and pharmacy, about what the right drug and the right dose is for you individually? You and I can metabolize the same drug differently. You could be a fast metabolizer. That drug goes into your system and gets out quicker, which means the doctor would say, well, to make it work, we need to increase the dose. When accurately, they shouldn't do that. And conversely, if you're a slow metabolizer, it stays in your system longer and you get more chance of an adverse drug reaction. An adverse drug reaction, last year, adverse drug reactions killed 125,000 people, put 2 million people in a hospital. And if I, as a pharmacist, don't address that and teach this to the next generation of PharmDs and existing pharmacists on how they can save lives, we'll never be providers. We'll just be pill counters. And that's not what I went to school for or what's in my heart. So we have embraced the future of medicine today by delivering, facilitating in the physician's office these pharmacogenetic tests, which are a simple swab of the cheek, and they're covered by Medicare. So every Medicare patient in the country should take this so that they stay healthy and stay alive.
You know, it's funny. I wasn't so much thinking of life-threatening interactions, although that's obviously much more important. But I was thinking about the person who has something that they take for headaches because their blood pressure medicine is giving them a headache, or somebody who has to take something for indigestion because they're getting an upset stomach. In fact, one of the cases I'm working on, and maybe I can pick your brain about this afterwards, it's basically ibuprofen with a little something for your tummy so that it doesn't get so upset for chronic use.
I know the drug.
However, do you know the price of that drug?
Sure, because it's a brand name that the manufacturer owns a patent on just by putting two drugs together, where an insurance company will pay for ibuprofen, even over the counter, depending on the strength, for over the counter, and the other drug for their stomach is also an over the counter medication. So at the end of the day, the drug companies and the drug manufacturers and the pharmacy benefit managers in between, like Caremark and Express Script and others, determine why the rise in prescription prices is out of control. We would sit with that patient and say, we can give you the same outcomes at a less expensive outlay of money by doing something different.
Right. And that is where that's the kind of thing that I just think is amazing. So I just have to back up to this for a minute because it's just making the concept of it makes me crazy. It's ibuprofen. Person takes it 3 times a day. Ibuprofen and fentimide. Oh, anyway,
okay.
It's something to ease your stomach.
It's an anti-acidic for your stomach to lower the acid in your stomach. Also, a drug you can buy over the counter.
$2,300 for a 30-day supply because one company has it branded and they've rooked in certain people, certain providers or a certain provider chain to be prescribing it. I don't know what's going on. As I've learned about this one in this particular project that I'm working on, it's just blowing me away.
Well, years ago it could be because the sales rep walked in and gave them more stuff than anybody else, but you can't do that. All you can do is buy them a better lunch. Again, the healthcare dynamics will take more than a 2-hour conversation. But sadly, we as the patient, and I am a patient, the reason why I'm so committed to adverse drug reactions is because I had one. My father-in-law had one that changed his life and made the last 2 years of his life a living hell. So everyone has experienced an adverse drug reaction. Everyone's experienced a side effect. You get a sour stomach because you take metformin, but you need to take it at the right time because if you don't lower your blood sugar, you're gonna die. So it's a balance. And where does that balance get best served? When you're talking to a patient, have eye-to-eye contact in a physician's office, and you spend the time and take the time to help them. And that's what we do.
I just think it's a terrific, unique service. And I think that I would like to encourage patients to ask their providers next time they're in, if they have multiple medications they're trying to juggle, if they could sit down and go through them with them. And if you're a provider, or maybe if you work for a provider's office, maybe this is a service that you should be considering as well. So I'm trying to think of what else. I think that's everything.
One thing before you go, because we're sitting in the beautiful studios here at Stony Brook. And Stony Brook is opening up a pharmacy school next year. And they are going to be, in my opinion, I hope my dean of St. John's doesn't get mad at me, a leader in the delivery of a fused educational pathway that combines the medical knowledge that they have here in the medical school with the new pharmacy students who are going to be entering the profession. They, along with the University of Binghamton, who is opening up their doors this September, in my opinion, see the future of bringing the pharmacist and the physician closer together. I'm just excited and fortunate enough that 3 years ago I went to my own doctor and one day say to him, I'm dying as a retail pharmacist. They're killing me. The shifts, the physicality, the fact that all I'm doing is flipping burgers, at the retail environment. And he embraced the concept, and we started what was called Pharmacy Friday. And now we went from one practice with 200 patients to now right here on Long Island, where we're impacting the lives of close to 6,000. So I know it works, and I'm very excited about the opportunity to have it grow out here at Stony Brook with practices and students alike.
My guest today has been Ken Sternfeld, and he is registered pharmacist, and we have been talking about the business of healthcare. So hopefully you enjoyed the discussion. All right, welcome back. You're listening to the Business of Healthcare at WUSB Stony Brook. This is Habanero. I wanted to do a tiny little piggyback on that story, and hopefully my guest, who's still here in the studio, won't jump on me and tell me how inaccurate this is. But if he does, I'll welcome his opinion. I forgot that I had done this. So I had gotten a question or an interaction on Facebook. So I hear this often and with different levels of intensity and drama. My insurance won't pay for whatever it is. So the first question I usually have is, well, how much would it cost to do it yourself? I had a Facebook friend recently complaining about Tamiflu. My insurance won't pay for Tamiflu because I just had the flu in April and took Tamiflu then. Except I had type B flu in April and now I have type A flu. This blows. Well, so some ideas before giving up and ranting on Facebook. Well, the first is check with your doctor and see if maybe something else would work. That would be my first suggestion. The second would be to call your insurance and explain the situation to them and ask them to cover it. The insurance isn't always the big bad boogeyman that people seem to think they are. It's run primarily by machines, but a lot of times calling and talking to someone and explaining is enough information for them to put in whatever override or do whatever processing they need to do. If you have an employer benefit plan, you might have a person at your company that can help advocate for you. So that's another avenue. And then the other thing is, especially if it's something like really important, buy the drug yourself and fight with them later. So granted, for the $2,300 drug that we were talking about before, that might not work. But for Tamiflu, oh, I'm getting the flag over here. All right, Ken.
Well, for Tamiflu particularly, there is no alternative. And the things you mentioned are good pathways, but you've touched on another difficult challenge called prior authorizations, which is an interaction between the physician and the insurance company to say that this is medically necessary. So the call that I would ask you to the patient to make is to her physician, not to the pharmacist, to the physician to say, you prescribed this drug, I need this drug, this is the drug that will make me well. It requires a prior authorization. It takes time for someone in the physician's office to contact United Healthcare, Emblem, et cetera, to say, Mary Smith needs Tamiflu. And I can tell you that with that effort, most of the time, unless the product is totally not on a formulary, most of the time in a period of, sadly, 24 to 48 hours. Imagine waiting with flu symptoms for that. But even quicker, you can get that product approved. But the last thing you said is really also important. Maybe not for Tamiflu. Sometimes the patient has to pay. I mean, we live in a world where sometimes you have to pay and then fight that battle afterwards. You have to stay well, you have to get your drug, and really fighting with the pharmacist, fighting with the insurance company isn't going to get you better. It's probably going to raise your blood pressure, so you'll need a higher drug next week.
And one of the things I also find with people, they get on an unbelievable tear about having to pay for things, but meanwhile, they're spending $228 a month for the cable, voice, and internet box. They're paying for cell phones. They go out and spend $100 on a fancy dinner, and then they're saying they're not going to pay, $40 or $60 for a drug because the insurance won't pay.
We see that a lot, but that's the nature of our culture, and I think that really spreads way past healthcare.
I think. Yeah, well, but particularly with healthcare. And I do think that that's one of the things that people should really seriously consider adjusting their thought pattern a little bit on. The insurance used to be for taking care of you specifically when you were sick. And now people have got a different idea. They want what they want when they want it, and they want the one that they want.
That's true, but the healthcare industry is not going to let that happen because they're going to run out of money. So they're asking the patient, they're telling the patient, take ownership on your healthcare. Shop for a better testing service. Shop for a more economical medical service so that we can save money together. And the patients have to take ownership of that as well.
And that is a perfect segue to this last segment on here. So one Facebook friend suggested something that I took a look at, but I don't know anything about, so I'm totally not advocating it or promoting it. GoodRx.com. So it's a website and a mobile app that tracks prescription drug prices and offers drug coupons in the United States. GoodRx checks more than 70,000 pharmacies in the United States. The website gets about 4 million visitors a month. They say it costs $155 cash for Tamiflu, but with their coupon you could get it for $58. So I'm not sure about this site, but it's certainly worth checking out if you're in self-pay mode for your prescriptions. Again, I welcome your ideas.
The Good RX and Bad RX coupon business is a fledgling huge entity that brings even more confusion, because coupons and savings certificates sometimes don't work for the people who need them most, which are people on Medicare, Medicaid, and or government-sponsored programs. So there needs to be a new way for people to pay for their prescription medications. And we recently signed a national marketing arrangement with a company called Blink Health. And Blink Health is recreating the way people can pay for prescription medications, where the price will be the same at every retailer that you go to, because they are putting total transparency to what you pay for your insurance. It could be higher. Well, here's the Blink price. And again, we don't care where you shop. We just want you to save money. That's why we as RXVIP are proud to sponsor and work with Blink Health and also Needy Meds, who offers patient assistance programs that do work with those needed patients. So, we'd like to say ask your pharmacist, but sadly he's too busy and she's too busy. That, it used to be all these commercials. Ask your pharmacist about this or about that. Well, the retail pharmacy syndrome doesn't allow us to answer your questions, and that's why we went into the physician's office to help.
Thank you again, Ken Sternfeld.